Hi, everybody. Welcome to GW Center for Integrative Medicine, minicast as we call it. I'm Dr. Misha Kogan, Medical Director, and I have a wonderful pleasure today of welcoming the newest addition to our team, Dr. Paymon Sadrolsadot. Did I say that right? Very
Yes,
good.
that's great.
You guys who are listening are for a special treat. Paymon has a profound academic experience. I'll have him talk about this in a minute. And we'll be talking a lot about holistic way or integrative way of taking care of cancer and some other diseases. So Paymon, thank you so much and welcome to the team.
Thank you, Dr. Kogan. I'm also very excited to be part of the GW Center for Integrative Medicine, and yeah, very excited.
So you are one of our most experienced practitioners at this point in the practice. So tell our listeners about your background, your training, which is extensive, and just your academic experience.
Sure. So I basically studied medicine, I completed the medical school in 1998, and after that I practiced as family physician for 7 years back home in Iran. So that was in 2005 when I decided to move to China to do a basically 5-year PhD education of Chinese medicine and acupuncture. At the time, it was just some medical doctors going to China and to Thailand, studying the education, like doing a 6-month course and come back to Iran and practicing. So it was basically very new to me and just interesting how they could treat some patients just with needles. And so I moved to China. That was 2005, and I stayed there till December 2009. That was a PhD program. I completed that. And after that, I moved to Canada, 2010, and then I started practicing as acupuncturist and Chinese medicine practitioner. When in 2014, I learned about the naturopathy program for medical doctors, like it's called a bridge program. Like instead of a regular 4-year program after a bachelor degree, they had a bridge of 2 years. So that was, I think, interesting enough.
We have that in US, right? I don't think the US has anything like this. I think it's
no, we don't have that. We don't have that. I think the way that it works, that there are more medical doctors who are not successful getting their license in Canada, I think kind of opens this path for alternative route. But I was basically already in the alternative path and kind of practicing as acupuncturist, teaching that. So I did that education basically 2014 to 2017, and also a 2-year residency program of naturopathy medicine, 2017 to 2019. And after that, I have been involved in teaching at the Canadian College of Naturopathic Medicine, and now moving to US, I am a faculty at Virginia University of Integrative Medicine, teaching different courses.
So what led you to cancer? I don't think a lot of naturopaths end up in cancer treatments because it's, of course, a very complex field.
I think it was basically a challenge. Like I like the idea of challenge. When I was at medical school, I used to participate, like that was on Thursday morning, that we participate in the hospital in Tehran, like a ground round for cancer. And it was just interesting for me still as a student to learn how different doctors, the surgeon, chemotherapy, radiation therapy, they kind of work together to see what are the best options. And actually, I wrote my medical dissertation in non-Hodgkin lymphoma. Then this kind of continued with me when I moved to China and did the Chinese medicine education. Still, the interest was there, and I decided to do, again, the PhD dissertation on lung cancer. So I was in Dongjimen Hospital in Beijing, and a year and a half, less than 2 years in oncology, hematology department. And that was a very unique experience to see how people how patients with cancer are treated on top of the regular conventional treatment, but also with herbs and acupuncture. And it was just interesting to see inpatient department where they were hospitalized, and then they received like decoctions, like the daily visits of doctors, and then the decoctions that they prepared. And probably more interesting, that the IV infusion of those kind of herbs and extracts. So they make those preparation kind of sterile, easy, ready for IV intravenous infusion. So that stayed with me. And after graduation of the program, I see different diseases. I see like more chronic diseases, like if you say more challenging to treat conditions, which in that way, the integrative oncology is basically my interest.
Do they do intravenous vitamin C in China? You remember?
Not in that setting, not in the the integrated Chinese medicine and Western medicine setting, but definitely they
do IV herbs.
That's correct.
That's
yes.
like a national healthcare system hospital. It's not like some private.
No. They are all national system. Right. Yeah, they are all national.
Yeah, we have a long ways to go. That level of evidence and that level of treatments that they're doing is very, very different from what we do in the US. Of course,
exactly.
None of this is standardized here, and most of these treatments patients have to pay out of pocket. Unfortunately, it's non-covered services. So sounds like lung cancer, non-Hodgkin's lymphoma, some of the cancers you're very experienced in. What other types of cancers do you like to work with?
What I see more is basically the most common types of cancer for male and female. So definitely the breast cancer, prostate cancer, colorectal cancer, and again, like sometimes like lymph node cancers of the lymph nodes. They are also sarcomas, like musculoskeletal type of cancers. I have seen all these types, but probably just because the more common ones are the breast, prostate, and colorectal. That's what we see in clinic more.
Right. Let me just take a couple of words for our listeners about general how we treat cancer at the clinic. Of course, it starts out with an appointment to you or to another provider, primarily Dr. Sarah, and I also see a couple of, like I try to see just a couple of different cancers, which I grew very interested in. Actually, also lymphomas, leukemias is one, in addition to prostate cancer and a couple others. And so then after the initial visit, we create a comprehensive plan. A lot of patients end up choosing intravenous treatments. Mostly it is a vitamin C and also a mistletoe. So those are the two big types of infusions we've been doing for many years. Of course, I just recently posted the YouTube video on efficacy of mistletoe in the more advanced forms of cancer. That's just study came out from Johns Hopkins. So we try to keep it very evidence. We're very excited to have you on board, partially because of this, partially because you're very grounded in an academic process, very grounded in experience of evidence-based medicine, not just there's a lot of stuff out there that, actually somebody talked to me yesterday about B17 and I had to say, well, there is really no evidence for that. And a lot of this is kind of probably not just on evidence, but directly toxic. So there's a lot of things out there. There's a lot of hype and wrong statements. So I know you provide a lot of evidence to your patients, but maybe just talk a little bit about that. Talk a little bit about kind of how do you structure your visits? How do you work with patients?
So for especially cancer patients, there are different levels that we try to work with. One of the areas is basically what we call kind of underlying cause, or like the general health, and what was the kind of the first reason, the reason why the cancer first happened. We work on the foundation, diet and lifestyle. What is the stress level for the patient? mental, emotional aspect. So kind of 1 hour to 90 minutes of kind of first intake, going over all these general things. And there are always areas that we can improve. Is it like, what is the level of the physical activity? What is the diet like? But at the same time, we will work on some tests, which will give us more information about the biochemistry of the body. A lot of times, patients who have already been to their oncologist, they have some tests, but our testing is basically a little bit more going in depth with the regular testing, with the specialty testing, and finding areas, potential areas like inflammation, like heavy metal toxicity, areas that basically there's a methylation problem. So different areas kind of that there might be a ground for the growth of the cancer. Some people say if there's no inflammation, there's no cancer. Like this is like the condition that can be very ready for the seeds of the bad cells to grow. So that's one area, which is basically foundation lifestyle. The second area is when our patients are with their conventional treatment, receiving chemotherapy, radiation, or before and after surgery, some of the treatments we do to support the conventional practices. So let's say certain kind of supplements before and after the surgery, just to improve the healing process, just to minimize the like adhesion bands and kind of fibrotic tissues. But also for chemotherapy, a lot of people feel just fatigue. There might be side effects like nausea, feeling nauseous. So there are certain supplements that we can work with patients in that phase. And interestingly, there are supplements that will improve certain conditions, improve the effect of the chemotherapy on the cancer cells. So it's not only removing the side effects, but also optimizing the effect of the chemotherapy.
And patients don't hear this from oncologists.
No. Usually it's like, if you go to another practitioner, don't come back here, or it's just us, which is unfortunate, I think. Like what we do is all evidence-based, or at least I try to be mainly evidence-based. Like if there's a certain supplements I'm giving to patient, we provide the article that is published and the evidence behind that. So our patients really like that, and they want to basically know about, like there are tons of discussions about supplements and different treatments if you search in Google online, but what is the one that is really beneficial and it has been shown either in vitro or in vivo that the growth of bad cells have been kind of reduced. So that's the another way that during the treatments we can help our patients. And there are also certain treatments that from a more natural approach can target the cancer cells itself. So there are discussions like high dose melatonin, the medicinal mushrooms, like the curcumin, the black seed, like the black cumin. So there are certain supplements which are all natural. The IV vitamin C discussion, the mistletoe that you just mentioned. So there are also other areas that from a more natural approach, we can target the cancer cells and ideally minimize their growth, and if we can also stop the growth. So these are different levels of kind of practice of naturopathy. There is one area that I really like, and that is within the concept of the naturopathic medicine, and that is prevention. And I think people will benefit from this area even more. Like even if there is no condition, but there has been people around in their family that there have been people with cancer, it would be always good to have a kind of check with a kind of practitioner who can do some testing. It can be general testing, but also it can be very precise testing of genetic, like genomic testing, and kind of see what are the predispositions that the patient have in terms of their genes. that is what we call it.
This is a new frontier, right? This is a new frontier in cancer. Can we identify genetically patients who are at higher risk, and what can we do for them? I mean, we definitely can't give them chemotherapy prophylactically, but we can give them diet change. We can give them certain supplements. Sometimes we can even give us something a bit more aggressive, like even intravenous vitamin C once a month, maybe quite beneficial and low cost and very safe.
Exactly. I think that is the area a lot of patients will benefit from, knowing their predisposition and kind of how we can, by diet, it can be very simple, just like adjusting the diet and lifestyle, but also sometimes helping the patient with supplementation with IV vitamin C to optimize their health. Because there are two discussions: are we within the normal range, or are we in the optimum of the normal range? And I think what we try to make a kind of individualized practice of medicine for our patients. If you say precise medicine, that's how we kind of go over all these tests, including the genomic, including the specialty tests, and see where are the kind of potential dispositions, and then work on that, adjust it, ideally keep the patient in their optimum health, and do not let bad cells have any opportunity to grow. So there are a number of ways that basically naturopathic medicine or naturopathic integrative oncology can work toward the optimizing the health of the patients.
Well, great. Well, I think that's probably enough for today, and this will give our listeners a very good idea. How about the last point? Anything really interesting about yourself? You have such an interesting background. You've been everywhere in the world. Anything else you want to add personally about yourself?
Yeah, just on the same note, I think I like learning. It's part of the part that I really like. Now it's kind of more with teaching in an academic setting, or with my patients. Like, probably my patients, if they like, they will enjoy a session with a lot of information exchange. So I try to keep kind of that style of learning, teaching with also my patient, because always we say like teaching or knowledge, that's the first, and that can adjust the diet and lifestyle. So we should have some information. I like that style. So just back to your question, yes, I enjoy that basically.
Well, that's why we hired you. That's why we love people who want to learn with us. I think we are in a settings where learning is the must. That's what we pride ourselves. Well, Dr. Sadrolsadot, thank you so much. Welcome again, and we'll post this on our YouTube channel. There will be links in the description to your bio on our website, and also a little bit of a description of what you do and your approach to patient care.
My pleasure. Thank you, Dr. Paymon.